Hello, everybody. Welcome to this final lecture for Philosophy 7 Bioethics. Today we're going to be talking about the end, the ethics of death, the end of this class, all of the above. So first, in this lecture, there will be sort of three different sections. The first, we'll be talking about the reading, Corman's chapter from his introductory textbook on whether or not, basically an argument as to whether or not death is bad for you. Then we'll be just discussing the philosophy of death and dying. And finally, we'll focus on euthanasia and assisted suicide. So first, it's worth getting clear-ish on what it is to die and what it means to die. And I think one thing, there's a classic kind of theory of what it is to die that is central to Western thinking that involves the notion of a soul, and partly due to, for like religious reasons and beyond. I think that the soul theory of death, where the idea is that when you die, what happens is your soul leaves your body, but your soul somehow lives on, is problematic when it comes to thinking about the nature of death in its entirety. And the reason that it's problematic is because if the soul leaves the body and what you are is the soul, then you don't really die in any case, right? In this kind of picture, on this kind of view, um, if you're your soul, then bodily death is simply a separation of the soul from something that the soul has, a body that it inhabits. And the soul doesn't really die in this case. The body dies, but it's sort of, you know, one of those. It's like losing a car or something, because somebody gets into an accident or with it. Um, is it really like bad for the soul to leave the body? I'm not really sure. Uh, it's interesting to think about, but the issue here is that really on this notion of death, you, whatever you are, don't really die, or unless you are some sort of combination of your soul and your body, and then maybe you die, but part of you lives on. But really, in this case, it's complicated to sort of make the case for the soul leaving the body as a good understanding of what death is. So I just want to surpass this view by immediately jumping to the notion, a sort of better notion of death, where a better notion of death, the sort of final notion, the absolute notion of death, involves ceasing to exist. So one moment you exist, then you die, and once you've died, you've ceased to exist. You cease to be uh, on this plane at this time. And on that view of what death is, it's possible to die whether or not you have a soul, whether or not you are identified with your soul and your body, etc. If the soul view is sort of, the view that people want to hold to, you can think of dying as when your soul ceases to exist. That is assuming that souls can be brought into and go out of existence. But I'm more inclined towards, a view that when you die, it's your animal body that's dying. It's a good question when you die, but once the animal body dies, that animal ceases to exist. Now, this brings us to our argument to look at for today. The argument that death is ultimately not bad for you. There have been a few, particularly some ancient philosophers, that have argued that death is not bad for you and therefore should not be something that you fear. Corman has recreated some of those arguments here, claiming that death ultimately isn't bad for you, and then that it's irrational to actually fear death in our chapter. And here I'll just discuss the argument itself, the first argument. So the argument goes like this. Premise 1, you cease to be conscious when you die. Premise 2, if so, then being dead is not bad for you. So, premise 3, or conclusion, being dead is not bad for you. Now, this argument is valid, which means that it's a good argument in the sense of the premises entail the conclusion. That is, the conclusion follows from the premises. If the premises were true, the conclusion would have to be true. However, that doesn't mean that the premises are true. So this argument could be bad in a different way. It could be unsound. That means that it could be an argument where where one of the premises isn't true. Now, premise 1 follows from our earlier notion of death, the ceasing to exist notion. And why is that? Well, nothing that doesn't exist can be conscious, right? So one thing, and this will come up again, one thing that it turns out to be true is that if something doesn't exist, then it can't currently have any properties, right? If it doesn't exist, it doesn't exist. There's nothing to be said about it currently having any properties, and so no thing that doesn't exist could currently be conscious, right? And so it must be the case that when you die, when you go out of existence, you lose all of the properties that are, that you could have while existing. You lose the possibility of having any properties that existing things can have, and so it's not even possible for something that doesn't exist to be conscious. So premise 1 is, without a doubt, at the very least, on the assumption that we're thinking about death as the ceasing to exist. Premise 1's got to be true. However, premise 2 is the questionable premise in this argument. If we wish to deny Corman's argument, then we should be denying premise 2. Premise 2 says, basically, if you cease to be conscious when you die, then death is not bad for you. And the basic idea here, obviously, I think, should be relatively clear. You have to be conscious for bad things to happen to you. Well, do you have to be conscious for bad things to happen to you? First of all, is a good question. Certainly, you could be asleep and unconscious while bad things happen to you. However, when you're asleep, you return to consciousness. And so you find out what bad thing occurred to you, generally speaking. And so, of course, in that case, consciousness is, still relevant. However, the idea here is supposed to be when you cease to be conscious in its entirety and are unable to return to consciousness. Well, the thought there is supposed to be that once you've ceased to be conscious in that way, nothing bad can ultimately happen to you because you can't lose any more happiness and you can't gain any more suffering and the like. So now, if we were to argue against this premise, however, what we would need to do is find a case in which it's possible for you to cease to be conscious when you die, and yet for death to still be bad for you. If you can do that, that's basically how you rally an argument against premise of this conditional form. You need to figure out a case under which the first half of the premise is true and the second half is false. The if part, the antecedent part, is correct, is true, and the consequent part, the second half, is false. If you can come up with an example or a possible scenario in which those two things can hold, then you have what might be thought of as a disanalogy or a counterexample to this second premise. There's a puzzle here, though, and the puzzle is that when things don't exist, like I said earlier, you can't have things happening to them, right? So non-existent things, there are non-existent things right now that could come into existence, right? They, like, future children, and there are people that are currently dying right now, and so going out of existence. Um, these individuals can certainly have what we might think of as future tense properties and past tense properties, right? So let's take the first child to be born in the 22nd century of the of Earth, of this plane of existence. That child will be, a biological human, right? That is a property that child will have, but they don't have it now. They aren't currently a biological human. They currently don't exist. Similarly, take let's take former President Ronald Reagan. He died. He was at one point the president. He is no longer the president. He is he's someone that doesn't exist anymore. He's ceased existing. He has gone out of existence. He no longer has any properties related to current times, right? He has things that were true of him. He has properties in the past tense, right? He was the president of the United States. He did live in, he was an actor from California. But currently, he's none of those things because he ceased to exist. So the thought here, and why this is a puzzle, is that it seems impossible for death or being dead to ever be bad for you, because for something to be bad for you, you have to exist. It can't be that you have a certain thing either happen to you or a standing, situation. Like what kinds of things can be bad for you? You can be harmed in certain ways. You can be in pain. Your wife can leave you, right? uh your child can come down with a terrible illness. Well, for all of those things to happen to you, you have to exist. And the thought here is, well, look, if you cease to be conscious when you die and you cease to exist, then death simply can't be bad for you, because it's not possible for it to be bad for you because you don't exist. Now, this argument doesn't argue that dying is not bad for you. There's a big difference between dying and being dead. Dying, of course, can be painful and can be scary. And it's ultimately, I think, rational to be afraid of dying a painful or scary death. But is that really it? Is it really just the case that dying is what's scary and death shouldn't be scary? Is it really the case that, dying is bad for you, but death isn't really bad for you? Um, is that totally right? Is there, or are there more reasons for thinking, no, death really is bad for you? Are there other ways that death can be bad, maybe? There are, I think, a couple of possibilities. On the one hand, there might simply be this idea that death itself is bad. Death is like objectively bad. And so we can think of death as bad for you because death is simply just bad. It's inherently disvaluable in the same way that certain things are good inherently, and then they can be good for you because they're inherently good. Maybe death is like that. But similarly, it may also be bad that it may be the case that death is bad or being dead is bad because of the value of mere existence or experiences that you can have. So now there's obviously something that we think of as tragic about a life that is cut short, right? Some car accident happens, or some child comes down with cancer. Um, these kinds of situations are seemingly objectively awful, right? Very sad. But what's wrong with these things, right? in the case of, say a terrible car accident where someone's life is cut short, they may never have suffered a painful death at all. It may have been scary, but we could suppose, then there certainly are deaths like this, that the car accident happened out of nowhere and everyone involved was immediately knocked unconscious and died painlessly and without even knowing. Well, in that kind of case, right, what exactly is it that is so sad and so bad about these deaths? The dying wasn't bad experience for anyone. But and yet we think of the deaths as bad, both for us, the people that maybe loved these individuals, and for the individuals themselves. We think of it as a bad thing that they died for them. And the thought maybe is related to something we've talked about earlier, the future like ours kind of principle. And the thought is that ultimately what's wrong or bad about death, especially in these cases, is that these people are missing out on their futures. They're missing out on valuable experiences, happy life, right? Even painful experiences. You might think that it's better to experience or to live a life with with some pain in it than to not live a life at all. It may be that, some life is better than no life, even if that life has hardship. Now, could it really be, though, that existence itself is a valuable property, that it has some sort of moral value beyond merely the experiences that a person can have or is missing out on? And this is, one of the issues here is like, well, we want to be able to say if dying when you're young is bad because you're going to miss out on experiences, well, it seems that dying when you're old becomes less bad because, you have less experiences to have sort of before you. Life is a finite entity, right? It will run out on you eventually. You will run out of experiences that you could possibly have, unless we could somehow change that. But if at the sort of later in life and you don't have as many experiences left to sort of have, um, if existence is still inherently something that's good or valuable, then it seems that dying might take away your existence. And so that would be bad for you. So could it really be that existence is a valuable property? This question has actually been, like, there's been a lot of philosophy that's been done in determining whether or not existence itself is a valuable property. And it relates to this rather odd argument for the existence of God. This argument is called the classical ontological argument. And it goes something like this: God is supposed to be the greatest being that can be conceived of, right? He's got all of the greatness making properties. He's omnipotent, he's omniscient, and he's omnipresent. He's, all powerful, he's all knowing, he's everywhere, he's all good, omnibenevolent, etc. Now, on this assumption that God has all these great making properties, think about this. Is it better for God to be existent or merely a conception, a conceived of individual? Would it be better for there to be an individual that was all perfect in every way and merely a conception of our imagination? Or would it be better for such an individual to exist? Well, it seems, at least on the way the thinking goes, that it's better for such an individual to actually exist than to merely be a conception or a figment of our imagination. And if it's better, then if God is the greatest being that can be conceived of, well, he must exist then, right? God has to exist if he's going to be the greatest being that can be conceived. If he doesn't exist, then he's simply not the greatest being that can be conceived, because that being that we're conceiving of is merely an imaginary being. Now, this argument is rather controversial. It seems to make some illicit moves and determine or prove the existence of God merely on the basis of the meanings of certain words. That's trouble. But even if something has gone wrong here with this argument, that doesn't show that existence itself isn't good. That just shows that, there may be some trouble with thinking that existence is good. So can we move on beyond this? Well, there are some problems for thinking that existence or that having experiences is something that's inherently good or good for you. And the reason is because there's this sort of asymmetric relationship between coming into existence, or ultimately there's a symmetric relationship between coming into existence and leaving existence, right? Coming into existence and dying or going out of existence. The question comes, was it bad for you to not exist before you were born? The thought is, ultimately, if it's going to be bad for you to die, to go out of existence, then it must have been bad for you to have not existed before you came into existence. Otherwise, on some sort of parity of symmetry rule, it would be very strange. Like, what could possibly explain the fact that you're lacking existence or lacking experiences before being born could possibly, why is that not bad for you? And yet, after you've lived a life and then die, it's bad for you to not exist or not have experiences after that fact. It's like imagining that for whoever your favorite fictional character is, it's bad for them in the end because, right now, because they don't actually exist. Does that even make sense that somehow there's something bad happening, for Sherlock Holmes or Thor, the god of thunder, right? It's not, is it bad that they don't actually exist? Intuitively, no, right? But if so, if it's not the case that there's something bad about not existing before you're born, then just not existing and being unable to experience things just doesn't seem like it's inherently bad for you. So then the question becomes, well, what exactly is the asymmetry here? Why does it not seem bad for you to not exist before you're born? And yet it does seem bad for you to cease to exist and, not be able to experience things after you die. What exactly could it be that explains this asymmetry? There are possible ways of answering this, I think. Some have to do maybe with the fact that we are forward-looking creatures, that we tend to think more about the value of future experiences than past experiences. We do, of course, remember great past experiences, but we're more hopeful about future experiences. And so in that forward-looking way, maybe there's a way of trying to explain at least why it is that we psychologically seem to value future experiences over past ones. But this is also, we're not worried about why we value future experiences over past ones. What's more important here is the question of whether or not experiences in an existence themselves are valuable for you and good for you. So now maybe when thinking about this on the whole, we can recognize that, dying surely can be bad for you. It involves things that are awful and terrifying, right? It's you lose bodily function. You stop being able to do the things that you want. You stop being able to love those that you want to love, right? And do things for people, or you stop being able to help. It can be painful to die and scary to die, right? You can go through long and depressing periods of time while dying. Um, and death may ultimately be bad for you. We may maybe just haven't stumbled across why exactly yet, but it's just not clear. It's just not clear, right? Why it's bad for you, if it is, and how it's bad for you. Um, in the end, it may not be bad for you either. Um, but it's always possible that death is just something that's bad, right? Not bad for you, but bad in general, sort of on the whole, right? In the same way that certain things are just good on the whole in general, right? We can think of like happiness as something that's just good. It's not neutral or bad; it's good. But why? I don't know. There's not a great explanation as to say why it is that happiness is good, and maybe death is just the reverse of that. There's no good explanation to say why death is bad, but it just is bad. And so we could maybe understand death being bad for you along those lines. There's a big maybe, though. This brings us to the second part of this lecture, where we're going to look more at what exactly death is and how we should think about dying in a more bioethicsy kind of way. So, first, there are three commonly recognized views of the nature of death. The first, sort of, and oldest, most classically recognized view of what death is the death of the body, the ceasing of bodily circulatory systems, the heart stopping, blood no longer flowing, lungs no longer breathing, no more oxygen to the brain. And, that seems like the classic and most certain form of death. The second, more recent and more actually widely held now among the medical community, is that death occurs when the brain ceases to function in any sort of recognizable way. So we have this definition of whole brain death. In this case of death, there's no measurable brain function that can be brought up on certain kinds of scans, and that is when death has occurred. The thought process being that your brain is the central control system for the body, and so once the brain itself has ceased to function on the whole, then the person, the person that's there, has died, whether or not they are continuing to breathe and continuing to, for their heart to beat. Once the brain has irreparably been damaged or ceased to function and can't sort of be brought back online, that person has died. And the third and final definition or thought about what death might be is actually takes issue with the brain death notion and argues that actually, when it comes to persons, when it comes to human individuals, we shouldn't be focusing on the entire brain in the entire brain's function. We should be focusing on just the higher brain functions, uh, particularly those located in the cerebellum and the cortex, and that we should be recognizing that ultimately, once those functions have ceased, once those functions have irreparably become, they're unsustainable, they're unreturnable. We can't get them back. That's when the person has actually died. And so, in a sense, brain death occurs even earlier than whole brain death, and an individual that has higher level brain death can safely be claimed to be fully dead. Now, these each have different sort of consequences, and the main ones ultimately depend on or sort of relate to situations in which people end up incapacitated and in certain kinds of states where they have to be on life support. And whether or not certain actions of doctors are right or wrong in these cases kind of depends on what we actually think death really is. Now, so there are a number of problems with each of these views, and we can discuss at least a few of them here. One problem with the sort of view that when your heart stops, you die is the question of what's so special about the circulatory system. Now, of course, the circulatory system is a necessary feature of a living human individual, and the ceasing of the circulatory system is a surefire way to determine when someone dies. But why should we think that it is the way in which we know, like, that it actually is what happens when you die? That really death only comes when the circulatory system ceases to function. What makes it different from digestion or cells like splitting? Your skin continues to grow after your circulatory system ceases. It grows more slowly, but it will continue. Your cells will continue to divide for a little while longer. What makes it the case that the circulatory system is so important here? It seems like once a person has suffered a certain amount of you know brain trauma and their brain is no longer functioning, um, and yet they continue to somehow be able to breathe and continue to somehow be able to pump their own blood, uh, why think that that individual is still somehow there just because one functional aspect of the human animal is continuing to work? Um, Now, of course, this view has some highly, understandable medical precedent, right? We didn't know about the brain being the central functional part of the human body until, medical science became a reality. People used to think, people thought for a long time that the heart was the core of an individual. And so there is some medical precedent also for determining whether or not a person is dead. We didn't actually have life-saving treatments and ventilators and things, life support systems. We didn't have life support systems for a long time, and so it was ultimately just you could tell whether or not someone was dead by determining whether or not their blood was continuing to flow. Um, but in a contemporary sort of case, and I think this ultimately puts the nail in the coffin, proverbially, in the uh, in this sort of to show that a person is dead, and even if their heart is still beating, we can imagine a rather coarse but interesting philosophical example. Um, Imagine the possible scenario in which a person desires to undergo a experimental head transplant surgery. And in this surgery, we hook up both the person's head and their body to basically artificial means whereby which the nervous system is being continuing in the body of the person is continuing to be sent the signals to keep pumping blood, um, while the transplant is being completed. And so ultimately, the head is removed from the body and the body continues to pump blood and sort of live on its own. There's some intravenous fluids that are continuing to feed the body, and the blood is continuing to pump. The lungs are being filled with a kind of pump scenario as well. However, in this highly experimental and, you know, difficult transplant, something goes wrong and the head of the patient dies. So the brain ceases to function, some machine fails, and ultimately the head of the patient dies. Now, in this case, in this context, it seems that the patient is dead. The head has ceased to function, and yet the body is continuing on. The body is still, there's still a sense of breathing that is occurring. There's still a sense of circulation, and the heart is still beating. But in this case, it seems wrong to think that the individual is still somehow alive. And so, in this kind of extreme case, that's at least theoretically possible, if not medically actually possible, we currently have, what seems to be the possibility of uh, a person dying while their circulatory system continues on. And if that's correct, then it seems that the first definition of death is problematic, highly problematic. Moving on to the second definition of death, the whole brain definition, um, we might ask this sort of troubling question: what in the world is a brain function? And what is it for all brain functions to cease? One sort of issue here is that it seems that, the circulatory system itself can still function, does it simply won't function if all things that might be considered brain functions cease. So the brain is surely the central organ of control in the body. However, the brain only functions in its controlling ways by using the nerve cells, the nerve functions, the sort of neuro pathways all the way throughout the body. And if all nerve traffic ceases to be, your heart won't continue to beat because it's not being told to by the brain. And this is interesting, at least in some respects, because it seems like, well, if your brain ceases to function, then shouldn't it also cease to be sending out nerve impulses to parts of your body like your heart and your lungs to continue your breathing? So how can a whole brain cease to function without the circulatory system also ceasing to function? It seems that, it's very unlikely that, the circulatory system could continue functioning if the whole brain function has died without some sort of artificial, intervention where we're continuing to somehow send signals down the nervous system to the lungs and to the heart to continue to beat, while the brain has fully ceased functioning. So that seems problematic. Similarly, uh, on the other side, right? So that's a reason for thinking that the whole brain view doesn't go far enough beyond the circulatory system view. On the other hand, the whole brain view seems problematic for the thought of that ultimately it seems like a person can suffer massive and irreparable brain damage to the higher portions of their brain, to their cerebellum and their cerebral cortex, um, without ultimately destroying all of the parts of their brain. And so the, other parts of the brain may continue to function while the person has fully lost consciousness and will never be able to recover, any form of conscious awareness, perception, capacities to speak, or even, possibly do anything. They will be a full vegetable in a vegetable state that must be, fed intravenously, and yet they still can continue to breathe and uh, to breathe and to digest, and their heart will continue to pump. It seems like this kind of individual is fully gone. They have no higher level brain function, and because they have no higher level brain function, they simply cannot be considered to be alive anymore. So that gives us some reason for thinking that the whole brain view, is can't really be totally right, and gives us a little bit of a push towards the higher level brain view. The higher level brain view, again, says that just higher level aspects of the brain are what are important for being alive, and once those things are irreparably damaged and cease to function, then then that's what it takes. That's ultimately what happens when you die. One thing that's very difficult to say here, and I think one of the reasons that whole brain death is still practiced in the medical community as the definition of death, is because it's very difficult to say what exactly constitutes higher level brain function, and what exactly the relationship is between higher level brain function and the rest of the brain. We know a lot about neuroplasticity now, and people will go through traumatic brain injuries or have certain amount of brain surgery, and different parts of their brain will literally rewire themselves for individuals to be able to regain certain kinds of neurocapacities. So you have brain damage in a certain place, and your brain, the part of your brain that remembers how to walk, is destroyed, but a different part of your brain will pick up the slack and rewire, and then all of a sudden you'll be able to walk again with enough practice. So this is the kind of this is a basic problem for the higher level brain view. Neuroplasticity seems like a possible, because it's possible, it's very unclear what exactly it means to say that what higher level brain functions are, and to locate them in particular regions of the brain. Finally, we have this bare possibility, and this is of course philosophical fancy and highly theoretical, of the thought that it may at some point be possible to transfer one's consciousness from a biological brain onto something like, a cybernetic brain, something similar. And in such a case, if it were possible, even though this is clearly purely theoretical, it would seem at the very least that one may not actually die in such a case, if it's possible for one to transfer one's conscious states from one, physical substrate to another. Then even in this case, if the higher level brain functions were to cease, and yet one's conscious self was in some way able to be transferred, again, it would seem that one has not died in the classical sense, even though one's brain may have ceased to function. This is, of course, purely theoretical. Some would argue that in this case, all that you've maybe really done is made a copy of your higher level brain functioning of your conscious self. And so really in this case, once the brain ceases, you really do die, but the copy lives on, and that's not really you, it's just a copy. But this is, again, theoretical, deep sea metaphysical question that's interesting to think about if you're talking about personal identity, and a little bit interesting to think about when talking about the metaphysics of death. But we need to leave that here for now, and not get too into the weeds discussing it. This brings us to the more interesting sort of bioethical questions of who gets to decide when someone actually is dead. Is it the doctor or the family, or maybe even the person if they filled out some kind of advance directive? Now, of course, once someone is incapacitated, others have to make decisions for them. Oftentimes, these decisions are an attempt to do what the person would have wanted. These are certain kinds of judgments made by surrogate decision makers. And sometimes it's possible that the person wasn't even conscious ever, right? So like in cases of children, um, babies, if they never even had any conscious decision making prowess, then sometimes people still have to make a decision for them in their best interest. Now, of course, doctors, so there are good reasons in some cases, I think, to pronounce people dead before they have fully ceased to function in their, circulatory system. Um, and, doctors do ultimately want to save lives, but sometimes you should pronounce someone dead if they will not be able to return to any semblance of fully capacitated life, and if the sort of resultant body has organs that are available for donation transplant, that can save lives. These seemed like good reasons for doctors to, instead of waiting until we have full body death, to actually pronounce people dead under the assumption that they're brain dead and will not return to consciousness. Um, but there's this question of whether or not there should be space for family objections to this kind of practice, and to doctors deciding whether or not someone has died, and whether or not advanced directives can be put in place that where a person actually asks to be kept alive until their full bodily circulatory system has ceased to be. Um, this is a good and interesting sort of final question here, right? Question about the finality of your existence. If you are convinced that you aren't really dead until your heart stops beating, um, it seems like it might be the kind of thing that is your final dying wish, right? Is to stay alive as long as possible. And if that's something that you desire and it's something that can be done for you, then it seems that if a doctor were to act contrary to that wish or desire, especially if it was made clear before you passed, then that doctor would be acting against your autonomy, acting against some of your own rights, even if you've become incapacitated uh, and no longer are autonomous. Similarly, it seems that there is at least some place for reasonable family objections and reasonable family understandings in cases of surrogate decision making, when it comes to questions of whether or not somebody would have wanted to continue to live or not. Now, this also brings us to an interesting set of considerations when thinking about doctors and their obligations and the obligations of people that practice medicine in general. And at the core, it gives us sort of a look at the thought processes behind what we should, like, what should we think the purpose of practicing medicine really is. Um, should we think the purpose of practicing medicine is to promote life or to promote health or to promote well-being? Um, and each of these will actually give us a slightly different picture of what we should be doing or what doctors should be doing sort of at the end of life, and whether or not doctors should be involved in bringing about death in a sense, or in being there while dying. It's an interesting question whether or not you want a doctor that is in the business of promoting life to be offering therapies and medicine when death is inevitable. Um, and so, similarly, when death is inevitable, how can health ultimately even be promoted? Certainly, maybe certain kinds of functions can be promoted, the ability to be aware, to be cognizant of what's going on, to be there with your family members. Doctors may be able to prescribe medications and give therapies that can actually, give care that promotes those things, but those aren't synonymous with health. I think at the very least, sort of in this vein, if we wish to think of doctors on the whole as both being uh, promoters of life and promoters of well-being in some cases, we can think of well-being as uh, incorporating a view of death that involves dying well. And so a doctor that tries to promote well-being on the whole might also be able to promote dying well or dying in a good way. Um, but it's still unclear, right, for the most part, on our everyday understanding of what doctors ought to be doing. It seems that doctors ought to be trying to stop us from dying. Doctors themselves think that they ought to be acting in ways that stop people from dying, and that seems contrary to a number of cases in which eventually death is going to be inevitable. Um, this brings us then to what doctors should do in what we can think of as extraordinary cases. And extraordinary cases, sort of as defined in the medical community, are cases in which a particular medical procedure or therapy or process or medicine that might promote health or well-being or wellness or life is considered to be riskier than the possible benefit that it can bring about. Now, this, though, is rather tricky and almost seemingly subjective as to what exactly it means for some process to be risky, and what it means for it to be riskier than the possible benefit. If the benefit is continuing to live, and continuing to live is extremely valuable, say because the person is still cognizant and still aware, um, then the risk associated with the procedure might simply not matter, at least to the individual themselves that wants to continue living. So there's this question of whose judgment actually matters here. Um, and in cases in which a person is actually incapacitated and has someone making substituted judgments for them, uh, it's very difficult, I think. If the person, if you're among the people that thinks like, oh, if you were to give like an advanced directive, so there's these things called like DNRs, which is do not resuscitate if your heart ceases or you stop breathing. Um, but if you're of the mind that no, you want to be resuscitated and you want everything to be done in your best, to try and keep you alive for as long as possible, just in case you come back into existence, um, and you're incapacitated, but you have a person that is making judgments on your behalf, family member, and and it's up to them to sort of make these judgments in your best interest on the basis of your previous judgments in the face of opposition from a doctor's point of view that a certain activity would be too risky and therefore an extraordinary treatment. Um, whose judgment matters here as to what counts as too risky? I think that it's very difficult to say at the end of the day what counts when the possible benefit is something that the individual themselves might actually, desire higher than anything else, right? I in a number of situations, I think the risk is worth the possible benefit when the risk is death and the possible benefit is continuing to live a while longer in some kind of comfort. Now, there's this question, though, and sorry for this, terrible joke image here, of what it is and if it's possible to actually die well, right? Um, and what exactly does it mean to die well? So, bringing us to something like a Aristotelian point of view, where the point of living is to live well, is to have a good life, to live in a eudaimonistic way, to try and be virtuous and try and aim at the golden mean. What would it possibly be to die well? Does it mean for to die with one's loved ones surrounding you? Does it mean to die in line with one's final wishes? Does it mean to die in a situation in which you feel no pain or you feel no existential fear? Um, Now, each of these things seem at least partly in line with like certain ways of dying well, but um, is it even possible to die well? Um, the thought process here, at least, is death is something that if we do think it's bad for you, then how can one possibly die well? What kinds of things can be done here for one to die well? Um, and then ultimately, is it possible for a person to die with dignity? So this, like, what is it to die with dignity? What is it to be in control of one's own death in such a way that one is able to, you know, not be afraid, face their death, recognize its inevitability, and actually, you know, be calm, cool, and collected at the end. So this brings us finally to the last part of this lecture, euthanasia and assisted suicide. So there are some generally accepted moral guidelines in medical settings when it comes to certain practices around death. One is that it's permissible to let someone die while impermissible to kill someone. This seems pretty straightforward. But it gets a little bit more complicated when we start thinking about intentions. So generally, it's thought that it's worse to intend someone's death than for a death to come about by means of some treatment unintentionally, right? So it's wrong to give someone a shot of morphine to kill them, but it's considered, not as wrong or not as bad to give someone a shot of morphine under the intention of uh, you know alleviating their pain, even if that shot ultimately leads to their passing. It's also true that withholding treatment and withdrawing treatment are generally thought of as on par, morally speaking, and they're not considered the same as killing someone. So if someone is on life support and you withdraw treatment, that's not thought of to be an active form of killing as much as it's a form of letting someone die. Similarly, deciding to withhold initial treatment is also an act of letting someone die if it is judged that the person, does not stand a very good chance of living upon receiving this kind of emergency medicine or life sustaining procedure. Now, so sometimes, given that terminal illness patients are unable to act on their own, um, it becomes a difficult question here whether or not certain procedures can be administered or certain drugs can be administered to these individuals, especially if they are still cognizant and competent enough to ask for them. And this is ultimately what physician assisted euthanasia looks like. So if a patient wants to die and is unable to, act on their own because of some kind of neurological disorder, or they're simply paralyzed from head to toe. What is it permissible for a doctor to do, for anyone to do? Is it permissible for a doctor in such a situation to administer a life-ending drug that ultimately kills the individual? That would be physician-induced death, which is ultimately what euthanasia is. To think about this, we need to think about the ethics of killing and the ethics of suicide. Now, first of all, thinking about the ethics of suicide, I think there's at least two things that are worth discussing. An Aristotelian theory of suicide is a little bit trickier to kind of come up with, but there's easier ways to think about suicide from a utilitarian and a deontological point of view. From the utilitarian point of view, suicide is like the decision to commit suicide is a weighing of future pain versus future suffering. Future happiness, sorry. Future pain and suffering weighed against future happiness. If it, seems as though a person is going to bring about more pain and suffering for their loved ones as well as for themselves than happiness at the end of life, then it seems that suicide may be justified. Just on also assuming that the suicide itself is not going to bring about an extreme amount of pain to one's loved ones. And so on this case, it seems at least minimally justified in certain kinds of cases. The deontological point of view tends to give the opposite result, however, in recognizing that suicide in most cases is actually highly problematic. And the reason here is that on a deontological point of view, particularly the Kantian point of view, it's your rational autonomous self, your decision-making being, your will, that is the thing that is of utmost value. And insofar as that thing is of utmost value, to choose to end that thing, to choose to cease to be, to choose to put an end to one's will, using one's will, is to treat one's will with less value than it's worth. So on the Kantian view, and Kant makes this kind of argument, if one foresees that one's future happiness is not going to be, the rest of one's life is going to be filled with a certain amount of misery, and it's going to outweigh how much happiness you're going to have. The Kantian view says you still should not take your own life in this case. If taking your own life in this case would actually be wrong, because it would be sacrificing something with an unlimited amount of value, your goodwill, for something with a limited amount of value, namely just your short-term future of some suffering and some pain. On this view, on the Kantian view in general, this would be to violate your own rights, and which is something that you can do. There are certain things on the Kantian view that you owe yourself, and one of those things is an attempt, as best you can, to perpetuate your own life. And so on these two views, you get a little bit of a different way of thinking about it. The deontological view doesn't, however, I think, fully restrict the possibility of suicide, at the very least in the sense of suicide that could happen in an extreme scenario, right? So imagine the possibility of a zombie apocalypse, and in a case in which a person is bit by a zombie and is with their family who are uninfected and knows that very soon they will become incapacitated, right? They will not be themselves anymore. They'll become a zombie unless they take their own life in the right sort of way, separating their head from their body, or some gruesome thing that you would see in a zombie movie. In that kind of case, it might be possible on the deontological point of view, from the deontological point of view, to justify a suicide. However, that's not the same kind of thing here. On that view, one would be self-sacrificing in order to save the rational capacities of a number of other people. And in that case, the self-sacrifice is at the very least possibly justified uh, through one's, through choosing to do what's right. Um, Both of these views are related, I think, to uh, theories of when and whether it's acceptable to kill someone. Um, in particular, right? So, on a deontological point of view, from a deontological point of view, um, it's acceptable to take a life in the service of uh, self-defense. But is it going to be right ever to take someone's life simply on the basis of the fact that it seems to them that they will continue to suffer? Can you morally kill someone on their behalf under their under their request, simply because they see the rest of their life as being not worth living? Um, the deontological view is probably going to claim no, because that would be to treat that individual as a mere means, even though that individual ultimately is asking you to accomplish that individual's ends, right? So that individual has this goal of dying, and they're asking you to help them achieve that goal. Um, the issue, though, is that they're treating themselves as a mere means to achieving that goal, and you would be assisting them in treating themselves as a mere means in that case. And so ultimately, that way of thinking about the deontological point of view would come up with assisted uh, or physician assisted euthanasia is probably ultimately problematic and morally wrong. However, on the utilitarian framework, if the person foresees that their future is going to be filled with suffering, and it will bring about less suffering to die, and they are unable to bring about their own end, then maybe it would be justified. Dr. Kevorkian is a very famous proponent of physician assisted suicide and euthanasia. In fact, to the point at which he carried it out multiple times. In most cases, he usually would help a patient complete the process of killing themselves. But he also, at least one time, actually administered the drug to a patient on camera. Um, he was tried multiple times for this activity. And finally, in I think it was 1998, he was actually convicted. Um, he believed that death was not really as bad as the suffering in many of these cases, and so actually, saw what he was doing as a form of mercy. He, in fact, developed a number of methods and machines for attempting to kill people mercifully in a certain way, allowing them to sort of drift off rather than continue to be in pain. Um, Ultimately, when he was convicted of the crime and it ended up sticking, he tried to defend himself in court, sort of after having not been convicted multiple times in the past. Um, and he failed and ended up being sentenced for 10 to 15 years for second degree murder, of which he only ended up serving 8, but still. He's the sort of most famous individual involved in euthanasia. Physician-assisted suicide, however, I think is at least somewhat more interesting and justifiable. Um, Now, if it's ultimately true that suffering is worse than death, then there's this question of whether or not it really makes suicide permissible in such cases, right? Um, is so on the one side, I think the utilitarian side generally, sure, right? Suffering is bad and almost certainly worse than death, especially near the end of life. So it's justified. From the kind of more deontological or Kantian view, the question is going to be shifted to: is there any amount of suffering that can ultimately outweigh the disvalue, like be enough, be problematic enough to outweigh the value of continuing one's rational life existence, ability to make decisions. And there may be one way, and one way is to foresee that one will lose their rational capacities anyway, on the basis of the fact that one is going to continue to slowly fade and experience suffering that will invade one's rational capacities, that will put a stop to one's ability to choose for themselves. And so maybe in such cases, when one would be suffering so strongly, it would be permissible, even on a deontological framework, to uh, ask a physician to, not to administer a drug, but to be able to get a hold of a certain drug, a lethal dose of a drug, so that one could administer it themselves. Um, Cases without pain, though, especially without pain that reaches to the level of the inability for one to actually rationally decide things for oneself, uh, does does are there justifiable cases of physician-assisted suicide along those lines? Well, I think that that's a little bit more difficult to answer. So, um, cases like this, where one might recognize that they're not going to ultimately be in pain, but slowly they're going to lose function, lose control over their own body, and eventually become an extreme burden on loved ones, where the loved ones will have to, take care of them, move them, feed them, clothe them, etc. Um, Certain kinds of, like muscular dystrophy and things like that, where a person isn't necessarily experiencing physical pain and suffering, but they may be experiencing some kind of psychological pain and suffering as they lose control while retaining a certain amount of rational control. There's another sort of interesting and deeper question here as to whether or not, on a deontological framework where we recognize a person's rational capacity as the thing that's the most valuable, that's worthy of being promoted uh, as much as possible, whether or not it's ever, you know, morally permissible for such a person to actually commit suicide. Now, in a number of cases, or in a number of states nowadays, there have been laws passed that we tend to get called the death with dignity laws. And in these cases, whether or not it's morally permissible, because it is a difficult question, uh, it is legal. Um, we have made it legal in a number of states, California being one of them. And ultimately, what happens in these situations is that patients are able to receive lethal doses of drugs that they can, like, from a licensed physician, that they can take under supervision. But in these cases, patients themselves must be pronounced of sound mind and be within a 6-month prognosis of dying from some disease. And the 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 play here is that the person is able to sort of feel in control of their own final life, their own death. And that's something that, at least for some, seems to be rather important. It gives them the ability to die with dignity and not allow the disease that they have come to have to take control and to completely determine all aspects of their end of life. At the very least, they'll have one thing that they can do finally, one final act to sort of put themselves in a place that they want to be. What's interesting about these drugs too, and with people that have studied them, is that oftentimes they're not even used. Oftentimes, people that pursue these drugs through a doctor will come to have these drugs, and then it will turn out that they were unnecessary, that they didn't need them, and that they died comfortably with family and friends without having to use them because they never experienced the kind of pain and suffering that they were worried that they might. Um, and interestingly, I think in a sort of good way, the sort of availability of these drugs and the legality of this process, the fact that it's legal, gives these people a certain amount of peace of mind that wouldn't have been available otherwise. And that seems, at the very least, to be a a boon um, to something that is so morally questionable and troubling at the end of life. So finally, I think we come to this question at the end of this class where we've tracked the beginning, the beginning to the end, what it is to live a good life. And the question at the end is whether or not it's ultimately possible to die a good death. Now, we can, of course, suppose that death isn't bad for you, as people have argued, and that merely dying is. Um, but even if death isn't bad for you, is it possible to die a good death? Is it possible to die well? And I'll wrap up this lecture just discussing two possibilities. Now, it's always possible that living life is something that is fundamentally and objectively good, and that dying is something that is fundamentally and objectively bad. This way of thinking puts different kinds of things into different kinds of categories. And so ultimately, on this view, you would think, well, if dying is bad, it's simply not possible to really die a good death because death is just bad. It's always bad. It's bad for you, it's bad for those around you. And so it's not possible to really die a good death because any death is ultimately a bad death. But we might think that ultimately there's a sense in which we can think about the difference between dying a better and worse death by accepting that, okay, even if all death is ultimately bad, that there's a difference between dying bad in one way and dying bad in another. It may be that there's, a kind of, that slowly fading away is bad, and that also burning out fast is bad. But there may be contextual considerations that make one kind of dying better than the other. In this, under this kind of guise, I think that allowing yourself to die slowly versus maybe taking one's own life near the end of life, we might see some glimmer of a moral justification for something like physician assisted suicide uh, because of the ability for a person to take back control. And so, in this case, even if it is not possible to die in a way that for death to be good. There may be a sense in which a person can die well. Uh, Dying well seems like something that, at least for some people, is rather important. And so I think it is something that ultimately we should allow some people to choose to do. That brings us to the sort of last thing that's worth thinking about when it comes to death, and the thing that most people really do want to talk about uh, when contemplating death, which I tend to see as at least a little bit of a cop out. When you're thinking about death, you shouldn't be thinking about what's after death, because that's what's after death. It's not death. You're not thinking about death if you're thinking about what's after death. Um, and but what happens after death is ultimately unknown. There are many different thoughts and theories about what happens after death, but given that there is no settled understanding, and it is unknown what's after death, I think we need to follow this kind of quote that was given to us by a famous philosopher at the beginning of the last century named Ludwig Wittgenstein. He said, "What we cannot speak of, we must pass over in silence." And here he was talking about a certain theory of metaphysics, but often he did also apply this to certain uh, ways of thinking about religion and the like. And the thought is kind of this: now, what it is that we can say clearly and can understand, uh, or like what it is that I can tell you and have you understand, is something that I can say clearly to you. However, there are things that are ultimately unknown. And when there are things that are unknown, it is difficult, if not impossible, to speak clearly about them. When things are unknown, we end up talking in terms of metaphor. We end up talking in roundabout ways that are not as clear as they could and or should be. And insofar as those are the only ways for us to talk about these things, like the unknown, the things that happen after death, there's a sense in which we should not speak about them. Not that we can't speak about them in certain kinds of theoretical contexts, but that we shouldn't speak about them under the guise of of a frank discussion about death. Death is the end. And as I discussed at the beginning, death, in the sort of ultimate sense, is ceasing to be. And under most understandings of uh, how things will go, even after bodily death, it seems, rather likely, maybe, that at some point all things will come to an end. All things will cease. All things will stop existing. And so I think worrying about what comes after death, uh, instead of thinking frankly about death, is to do a disservice to oneself. Rather, it's to ignore certain stark and real truths that need to be uh, thought about seriously. All right, I'll leave everyone with that. This was the last lecture. I hope it's not too dark. I hope that that's at least a little bit uplifting at the end. And I hope you enjoyed the class, and thank you for taking it. And good luck on the final exam.